When patients have both macular degeneration and cataracts, the two function together to decrease the vision. The portion of the visual handicap caused by the cataract comes from the front, and the macular degeneration is in the back. When we're doing our cataract surgery, obviously we're only working in the front, taking the cataract out. The remainder of the visual handicap portion due to the macular degeneration will still be there after surgery. So if this is very significant and the cataract is not that significant, your vision will improve only a little bit. If the cataract is the majority of your problem and the macular degeneration is not that much of a problem, well, cataract surgery will be much more helpful to your vision. The bottom line is the portion or the percentage of your visual handicap caused by the cataract, that's what we'll be able to fix with surgery. The portion due to the retina or the macular degeneration, we won't be able to affect that. A most important thing to remember, when I'm doing cataract surgery in the front part of your eye, I'm not going to be getting back to the macula. I'm not going to be causing anything that's going to make your macular degeneration get worse. Macular degeneration is going to do whatever it wants to do over time. There are two major types, as you may know. The dry macular degeneration stays the same for a while, may decrease the vision a little bit, stays the same, and it continues like that indefinitely. We hope that it will just level off, but sometimes it can progress. Occasionally, the dry macular degeneration can progress suddenly to what's called wet macular degeneration. Wet refers to bleeding, and that bleeding can cause a hemorrhage under the retina, which can result in a very significant visual loss. This can happen overnight sometimes. 10 years ago, we had nothing to treat wet macular degeneration with. Now we do. We still don't want you to have that kind, but if you have it, there is a better treatment than there was in the past. The bottom line to take away from this is, when we do cataract surgery in the front, we're not going to be doing anything to make your macular degeneration worse. They've done studies that show that cataract surgery does not make macular degeneration worse. Over the course of 28 years, I've done about 15,000 cataract surgeries. I've seen probably 4 patients have cataract surgery in the front and have significant macular degeneration problems 2 or 3 or 4 months later. One person might think, well, there's probably a connection there since the cataract surgery is first and the resultant change and loss of vision happened second. In my experience, I've done at least 6,000 or 7,000 patients with varying degrees of macular degeneration. These are the only 4 that got worse. So I think we can agree that if something occurs less than 1 in 1,000 cases, it's a random event and there's no cause and effect. That's something that's very important to remember when we do cataract surgery.